This video is to help you with the multidose Gonal F with mixing and administration. If you've been prescribed multidose Gonal F is an FSH product, follicle stimulating hormone. So you're taking that product to actually stimulate the ovaries to produce multiple follicles, which in turn produces multiple eggs, preparing you potentially for egg retrieval or for even an intrauterine insemination. So it's just good to know why you're taking something, because I think that's the first big thing to know. So that's the reason, is that it's going to help you produce multiple eggs. Next thing is, how is this medication administered? This medication is a subcutaneous injection. Sometimes nurses will say it's in the fatty tissue, so that's correct too. So to keep it a little less clinical is to say that it's a little subcutaneous injection using a small needle that's going to go in your lower abdomen, lower belly, or your upper top or outer side thigh area. That's strategically where we usually have our patients at our clinic, and I think most patients at the clinics are doing it, that injection in those areas. But again, you would always contact your clinic, your nurse, your team, just for verification, and they will always review with you your dosage and the injection technique and the area to inject. Lastly is this medication, because it is in the subcutaneous or fatty tissue, you could self-inject. So think of insulin when patients before pumps were administering a medication that was needed to be learned by them. Oftentimes diabetics know how to do their own injections. So this is kind of like that. The difference between that is that for diabetes, that's for their lifetime. For your window of fertility, there is a beginning and an end to the injection during the cycle. So I want you to know that. It's just to realize that with each of these medications that we will review or sometimes have you taking, there's always a starting point and there's always an ending point. And there'll just be a brief period of time that you might be taking it to help the action of what that drug's to do. So next step is your supplies that are needed for this medication are going to be your multi-dose kit. You may have a smaller box than this from the pharmacy, but this is a little demonstration kit of mine, but you will have a box similar to that. And in that kit, what you will have is 1 vial of powder. So the medication of multi-dose comes in a vial, but it is in powdered form. And a lot of times the nurses call it a powder, a tablet, a wafer. There's no wrong way to say that. There's just many different ways to say the same thing. So that's what you want, is that 1 vial. Know that that's the medication, is that 1 vial. And it's a multi-dose. We'll talk about that a little more. The other thing that you will need is 1 pre-filled syringe that is provided in your packet. You have a pre-filled syringe that is provided with sterile water, bacteriostatic water, and that's going to help to dissolve the powder that is in that vial. And then you will have 1 Gonal F, 1 milliliter, 1 cc, and it does have attached to this one a 27 gauge half-inch needle. And there'll be multiple of these because you're doing that injection for more than 1 day typically. On average, just to put it out there, sometimes anywhere between 7 to 10 days that you might be taking this. Could be a little more than 10 days, but on average, 7 to 10 days of an injection of multi-dose. And so the supplies you need is, finishing it off is this injection syringe, which is a Gonal F 1 milliliter syringe, but it also has the appropriate size little needle for the type of shot that we are going to do. So as with all the videos or anytime I'm showing mixing of medications, I always remind you that it's not sterile technique, but it's clean technique. So what you want to do is just always good to wash your hands. For sake of the demonstration, I'll take a little bit of hand sanitizer, but mixing medications is not a sterile technique. It's just that it's a clean technique. So it's always good to have clean hands after you've gathered your supplies. Clean those hands, if you will. First step that we're going to take is take that multi-dose vial, and in here for the simulation of this video, there isn't a powdered pellet in here, but you would have a little powdered tablet in here. When you have that tablet, you're going to uncap and hear a little click. And then what you do is, remember I do say in other videos that this is sterile under there, but it's the nurse in me to always wipe the top of that vial with a little alcohol wipe, because any surface that I'm poking with a needle, I always want it to be clean. So that's the reason I'm cleaning the top of the vial. If you ever forget that step, it's okay. Don't panic. It's perfectly fine. It's just, it's something that when you have a multi-dose vial, I want you to get in the habit, because each night you will be utilizing the same vial for your medication or your injection. And so it's very good because it'll be open to the air. That's just good to always clean that top. Okay, clean it with that little alcohol pad, or like I said, you can have your little rubbing alcohol and a cotton ball doused in alcohol just to rub that top of that vial. Then our next step is to take the injection pre-filled sterile water and uncap that needle. And what you're going to do is poke that needle through the center of that vial where there's a rubber stopper, and you're going to gently push the solution of that water, and do it gently because the vial will have little bits of bubbles. It may actually, with that powder in there, it's going to be a little cloudy at first, but what you want to know is it's going to clear up. Sometimes what I tell patients is once you've injected that fluid into that vial, then you can remove the syringe, but then gently roll the vial. You don't have to shake it vigorously. You don't want to create a lot of bubbles. You're just kind of gently rolling because you want to get all that little powder that's in there to dissolve with the water that you're being supplied. Now, the biggest thing that somebody might ask is, how long will this vial last me? That's a difficult question for me to answer for you with showing mixing administration. And the reason that's difficult is that I don't know your dosage. Your physician and your nurse will be developing a plan of your dosage. And so somebody who might be taking a smaller dosage each evening of this product, or each day, I should say, no matter what time of day you're taking it, your clinic will advise you. It may last you more days than someone that is taking a little bit of a higher dosage. So remember that your dosage is tailor-made to you based on your age, your diagnosis, and your history. And your doctor comes up with that plan. But for everybody that uses multi-dose vial, there is typically more than one injection in here. So that's what you just want to know, is once it's empty, you'll know, because you won't be able to draw out any more of that medication. So in the very first night, it's nice and full. And then what you do is you take your needle that says 1 ml syringe, 27G ½ inch, and you open it from its package. It's sterile in there. And with live TV, I've just actually bent the needle a little bit, so I'm going to actually put that down. See, even for me, things like that happen. And that's perfectly okay. I could feel myself bending that needle because it's very fine. So if that ever happens, I'm going to put that in the sharps container, but let me try again. See, it doesn't matter. Even you can have that happen, but even I can have it happen, so don't worry. So I'm taking out a brand new needle and syringe. And what I'm going to do is let you see that this is calibrated in international units of the drug. So meaning that when your nurse gives you your number, that's what she's referring to, is the number of units for that medication that you're going to draw up. So I'm going to use the example of if I'm drawing up 150, which this is the little 150 line. So what I'm doing is I'm drawing down, and the top of the plunger I'm placing on the 150, and I'm going to inject a little air. Because whatever amount of liquid that I'm drawing out, if I'm going to draw out 150 units, I want to equalize a little bit of the pressure that's in the vial. It just makes it a little easier if you draw up that air. It's not incorrect if you don't. It's just a little step that can help make it easier, so never panic if you don't do this, okay? But I just find that it helps it a little bit, make it a little easier to draw up. So you would insert that needle into the vial, right in the center. Oh my goodness. Hold on just a sec. There we go. Okay. Insert that right into the center and then turn it upside down, and then you inject a little bit of air in there. That helps to sort of equalize things a little bit. And it's actually pushing down on the plunger for me right now because of that pressure. So I'll let it do its thing. But then eventually what I'm going to do is I want to gather the amount that I want, which is 150. So once I get it to the 150, I'm going to turn it right side up, and I'm going to remove that needle. A little bit squirted out because I had a little pressure there, but just so that you know, sometimes that will happen. It's not a wrong thing if a little bit squirts out. It just means you're losing a little bit of the drug, but it can happen even to those of us working with the medication, just so that you know. So if that ever happens, just go with it. You still have lots of nice medication in here, okay? Your next step will be that you're going to cap this needle until we're ready to inject. Just gently cap it. And where I'm going to see that I have a few bubbles, air is not an issue going into fatty tissue, but sometimes some of the clinics and the nurses may recommend that you give a little tap if you see any little air bubbles, because it just helps to let that air rise to the top, and then it won't be as part of your shot. But don't feel worried if you can't get rid of an air bubble, and there are many times you can't. Just let it be. The important thing to know is that this is not going anywhere near a vein, and that is when air is an issue, when it's near in a vein. This is going into your belly and your upper thigh area, so it's a little fatty tissue shot, so you do not need to worry about that air. Where it is that you're going to administer, I'm going to get my little mannequin here just to show you that you are going to give the injection. It's going to be in either the lower belly, okay, or the upper thigh area and side outer thigh area. No area is better or more efficient or more effective. The little fatty area in here is fine for this medication, and you would move this around for each multi-dose injection you would take. This area here, you move the injection around in the top thigh or even in the side outer thigh. So I always get asked a question of, if I use my belly, do I have to stick with my belly? No, you can use belly and add in the thighs. You could do just thigh and no belly, or you could do a combination. And whichever way you choose to do that is perfectly fine. It's a-okay usually, but your nurse will certainly guide you too as well with where the sites are. But the thing about a shot that's happening for more than one time, it's always making sure that the patient's moving it around from where they gave it previously. If I were to give this person her injection and she were laying down, I would have her lay on her back, and this injection would go in at a 90-degree angle on the belly, would be a 90-degree angle on the top of the thigh, and a 90-degree angle into her side thigh. Because you can also self-inject, though, if she's standing or sitting, this would be the position of her body. So if her position of her body is that she's standing and sitting and self-injecting, the angle of the needle is going to just go straight in. And a big question I always get asked with the shots is, does all the needle go in? And you actually really do need to make sure with this one that all the needle goes in, because you're really only putting in a 1/2-inch needle. And we all have, as you can see, I'll just show you this on this mannequin, we all have this yellow area, which is fatty tissue, and it's usually more than a 1/2 inch. So the idea is that's why we're picking these areas that have good fatty tissue for you to use, but it's very important to get it all the way into that area, okay? So one of the things that you'll want to do is make sure that you clean the area with alcohol. And one of the next steps we do is we uncap the needle. We give a little pinch to the skin. So what I'll show with my arm is that when you're pinching the skin, you just don't want to pinch too hard and squeeze too hard. You could get bruises. And if you get bruising, it's occasionally happens to people when they get blood drawn or shots given. It's a-okay. You just want to make sure you don't administer another shot in a bruise. If you get a bruise, let it heal. But the key is sometimes if I see somebody that might have multiple bruises, I might have them show me the technique of their pinching, just to make sure that they're not pinching too tight. So it's really just you're lifting the fatty tissue up off of the muscle, so it's a nice, just gentle lift. I like to kind of think of it as a lift versus a pinch. So we're going to give a little lift to that fatty tissue. We're going to angle the needle straight in, and we do not need to jab, okay? No reason to trauma the skin that way. Just place it gently to the skin, give a little pinch. There's where you will feel your mosquito bite. That's exactly what it feels like when those little needles go in, is a little quick mosquito bite. Now you don't even feel it. Then we press that fluid in there, and with multi-dose, you probably will not even feel that medicine go in. Most patients that I speak to after I've taught them their shots, they'll say, wow, I was really surprised at how little you said I would feel, and I actually really didn't feel anything, and I thought I would feel a lot more. And that makes me happy, so that it reassures them and reinforces what we're teaching. And then when you remove the needle, you can do a little 1, 2, 3 count, move it gently, set it down, and then you'll put a little pressure there, just to, if there's any fluid that's moving, you want to keep it in the skin for it to absorb. And you also want to, stop any little bleeding. But usually, like a mosquito bite, you might get a little bleeding from these little tiny shots, but not much at all. With that multi-dose, the key thing to know is after you give that injection, what you are going to do is then put your vial in the refrigerator. And then on your next injection, what you can do is take it out. You could leave the vial on the counter for a few minutes, or you could draw up your dose and leave the dosage, just what you need, out on the counter for a few minutes using the syringe, several syringes that you have. Because remember, it's a multi-vial dose, but you have many syringes so that you can do more than one injection. Once this vial is empty, so say you end up having a dose of 150 and you draw up 50 from this one that's just has 50 units. So draw up the 50, cap the needle, open up your new box, mix that vial with the one syringe that has the liquid in it, mix that vial, let it settle, and then take your syringe, clean the top of that vial that already has the 50 in it, and draw up the remainder 100. So you might be using two separate vials, one vial that had 50 in it and a brand new one that you were able to draw up the 100 for your total of 150. So it still doesn't have to be two shots. It can still be just that one injection. But you know, when the vial's empty, it may not be able to give you a full dosage. So that's when you mix a new vial and draw up to the rest of what you need that equals 150. Okay. So I hope that video helps you to understand the multi-dose Gonal F product, and best of luck with you in getting started on your injection journey.